Hello, my name is Madison, and I'm talking about my internship experience at Coastal Dermatology and Surgery Center. There we go. Coastal Dermatology and Surgery Center is a dermatology office located in Wilmington, North Carolina. It is owned and operated by Dr. Heather Loesch, whom is a board-certified dermatologist as well as a Mohs surgeon. Their practice largely focuses on skin cancer patients, as Mohs surgery is the most up-to-date way to remove a skin cancer on someone's skin. Within their practice, they have their own labs to process those skin slides in order to detect the cancer within the skin cells. This is a really awesome and unique feature to coastal dermatology, and this allows for the Mohs surgery to go a lot faster with the slides being processed within the office. The populations that are served, coastal dermatology focuses their practice on the treatment of skin cancer using the Mohs surgery technique. Most individuals will not develop skin cancer until after the age of 50, making their target population adults over the age of 50 years old. Another population that really is more susceptible to skin cancer is Caucasian population. Typically, the lighter your skin complexion is, the higher the risk of skin cancer you do have, meaning that most individuals that do come in for treatment come in from a Caucasian background. The types of insurance they take, coastal dermatology takes all forms of Medicare and most forms of private insurance. They do not take Medicaid, meaning anyone on Medicaid is unable to be seen within the facility. Patients do have the option to do private pay. However, that is not feasible for most patients, as the visit alone with no sort of treatment done is $204. And with treatment, it only goes up. So it's really not feasible for patients to pay out of pocket. Meaning that if they are on Medicaid, they typically are not able to be seen within the office. Who all works at Coastal Dermatology? At Coastal Dermatology, there is one MD, that's Dr. Loesch, followed by two PAs, that would be PA Rachel and PA Kelsey. They are the ones that consult with the patients. They also have a histologist that prepares the skin cancer slides. There's also medical assistants that assist the physician and the physician's assistant while in the room with patients. There are front desk receptionists along with two office managers and a person devoted only to billing within the office. My internship's responsibilities, they varied depending on what atmosphere of the practice I was in that day. We had front of office responsibilities and then back of office responsibilities. So the front of office responsibilities was more front desk receptionist responsibilities that included confirming patient appointments, checking patients in and out, collecting insurance information, and processing it within their computer system, along with scheduling upcoming appointments after the patient had already done their visit. The back of the office was more of the clinical setting. So in that setting, I would clean the rooms after each patient's visit, chart spots that were being treated by the physician or the physician's assistant. I stocked rooms with medical supplies, and I shadowed just in order to gain more knowledge about skin cancer and skin conditions that were typically seen within the office. For my internship project, within the facility, I had noticed a lack of educational materials for patients that were not undergoing Mohs surgery. This included patients experiencing actinic keratosis, seborrheic dermatitis, and then seborrheic keratosis. This led me to create those three pamphlets based off of those three skin conditions, as they are the most commonly seen skin conditions within the office. The pamphlets can be used within the office and can be displayed within the office or the rooms of the office for patients to grab after they've been diagnosed with that skin condition. I thought this would be a great way for patients to be more educated on what they have been diagnosed with, because a lot of times the physician or physician's assistant just does not have enough time to completely educate that patient on exactly what is going on with their skin. I felt as though a lot of times it was just treating it with no education on exactly what it was. So that was really cool, creating those pamphlets and laying out what it was, risk factors associated with it, and then treatments provided within the office for those skin conditions. The public health domains that this internship included was mainly human health. While working on the clinical side, I gained a tremendous amount of knowledge on the human skin. I learned about the many different skin conditions and treatments that follow those skin conditions. Another big part of the internship was health promotion. This is a major aspect in both public health and within the dermatology community. An example of something that is really promoted within the dermatology office was sunscreen. It's been proven that the daily use of sunscreen can really help reduce a person's risk factors for getting skin cancer and other skin conditions within their lifetime. So the daily use of sunscreen was one promotion that was used in the office, and every patient that came in was asked if they use sunscreen daily, and if not, they were really pushed to start using sunscreen on their skin for a daily basis. The best and worst parts of my internship, the best part of my internship was learning more about skin conditions and treatment that followed those skin conditions. I've always really been interested in the skin, so I really enjoyed that aspect of the internship. I also really enjoyed interacting with the patients and helping them feel better in their own skin. My favorite part was rooming patients. This is where I asked them a set of questions to better understand the reasons for their visit, and also so that I could give the physician or the physician assistant a rundown on the patient before they went into the room to visit the patient. And those sets of questions really talked about, were they still using the same medications? What were they here for? A little bit about their background and history. And I really did enjoy doing that. The hardest part of my internship was keeping up with the fast-paced environment. I felt as though you really had to push your way into, going to see the rooms, and you really kind of had to push your way to get those opportunities instead of those opportunities just coming to me. So that was really a lot more of a learning curve for me, but by the end of it, I did feel a lot more confident asking to do things within the office, and I think it definitely drove me to be more of a confident person. The most memorable experience while at Coastal Dermatology was helping an older woman get to checkout after undergoing Mohs surgery. This surgery can range in intensity depending on how much the skin cancer has developed and how deep it is within the skin. This woman had a serious skin cancer spot on her nose and had undergone multiple rounds of Mohs surgery, meaning that it was pretty deep within her skin. After undergoing all of that, her body was in shock, and I really can relate to my body going in shock, especially after an invasive type of, treatment. Of course, they do give anesthetics or numbing creams for this procedure, but you still are awake while undergoing it, so it can be a very stressful experience on the body. She was also all alone and during this visit and was unwell by the end of it. She could barely walk to the check-in station, and I really noticed that no one was helping her, so I did take it upon myself to make sure that she got to check out and that she had a ride home and that she was okay. I went and got her water and some food. So that just really made me feel pretty good inside. Also, I really do want to become a nurse, and I noticed that in helping people, it makes me a lot happier. So that was just a really cool and memorable experience for me. And that is the end of my presentation. I really hope you enjoyed it. I really enjoyed my time at Coastal Dermatology. Thank you.